Now make sure that you keep the cold compress on the back of your neck, keep the room darkened, and that feverfew tea should help that headache soon, sweetheart. I'm Katrina Pike, and today we're going to talk about health and medicine in the 1850s. For what was it really like? So medicine in the 1850s certainly wasn't the same as it is today. They didn't know all of the things that they know today. And you have to keep in mind that Louis Pasteur had only just come up with the theory of germs in the late 1850s, in 1857 to be precise, after he'd worked with brewers to look at fermentation processes and discovered that bacteria was spreading through fermentation. It wasn't an idea that caught on really quickly. In the 1850s, the housewife was both nurse and doctor to her family. Doctors were very scarce, and so one of her references might have been a book like this, The Married Lady's Indispensable Assistant, filled with all kinds of home remedies, some of which would be highly questionable today. But remarkably, there were a number of herbs and plants used in the 1850s for medical treatments by the housewives that are still commonly used today. I mentioned at the beginning feverfew. Well, feverfew could be used to both help a fever, which is what its name says, but it could also be helped in the case of a migraine or a headache. So back to doctors. We know that there were two doctors very early in Pickering in the 1850s. We know that there was a Dr. Tucker and a Dr. Burns. A memory about Dr. Tucker taken orally from an early settler who lived into his 90s in 1935 said that as a child he went to Dr. Tucker for a very, very sore throat, that he couldn't swallow very well and was in a great deal of pain. Dr. Tucker lanced his tonsils, he bled them, and prescribed some charcoal. After a couple of days, as well as a pack around his throat to keep his throat warm. After a couple of days, Seneca Palmer felt much, much better and went to pay his bill on behalf of the family, and it was 75 cents. But doctors in those days could be expensive for some people in the 1850s, and if they weren't expensive, sometimes they simply weren't trusted. As I mentioned, Louis Pasteur had only just discovered the idea of germs in the late 1850s. It would take a little while to catch on. In the meantime, there were home remedies. Follow me into our medicinal garden. This is our 1850s medicinal garden at the Collins House at Pickering Museum Village. And here is our valerian. It was good to ease a headache, but it could also be good for insomnia and also to help with anxiety. And in pill form still today, people do take it as a homeopathic remedy to help them calm down. But in terms of other things, if you wanted to help with dyspepsia or an upset stomach, which is something people suffered from a great deal in the 1850s and earlier, mostly because food preservation was so poor, you might have to take something like wormwood, which, as its name indicates, could help get rid of worms, but it could also ease an upset stomach. Horehound, and you could probably associate it with candies or horehound candies, which are great cough drops still today. Horehound was very, very good for easing a sore throat. Now the settlers in Pickering, or the later settlers of 1850s Pickering, didn't have to rely on doctors. They had the Woodruff and Bentley pill factory just up the street in Brome. William Bentley and his partner, Nelson Woodruff, formed a patent medicine company in the 1840s. And later in the 1850s, they hired as many as 6 young women to work in their factory, as well as a manager. Then in 1851, their company ordered 28,000 labels for their salves. Imagine 28,000 labels. They did business as far east as Montreal, and they even did business into the United States as far as St. Louis. They advertised in almanacs and newspapers, and some of the products that they made and sold right from Brome, Canada West, included Egyptian hair oil, Oriental salve, and burdock bitters, which was considered a very important elixir to help the being of your intestinal system. Now, one of the things that they like to advertise about their burdock bitters was that it was a temperance remedy, meaning that it was free of alcohol. But that wasn't quite true, because there was as much as 20% alcohol in most of the elixirs of the day. So, but the best, it was still an apple a day keeps the doctor away. Because at the very end of the day, with so little known about medicine, you were sometimes better with your home remedies.
Dum 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 dum, ba ya dum dum.